Health insurance costs seem to only move in one direction. But what if a major cost-saving tool is already on your phone? By using telehealth, the healthcare system could save over $537 million a year from just one single change. These aren't abstract numbers. They represent a fundamental shift that is already causing some insurers to offer lower premiums. It begins with a simple fact. Virtual appointments are fundamentally less expensive to provide than in-person visits. We will now break down how telehealth savings work, from your wallet to your doctor's office to the entire system, and how you benefit. So, where do the savings begin? Let's start with the money you don't spend just to see a doctor. Consider a typical doctor's visit, the cost of gas, parking fees, and potentially unpaid time off work. Telehealth removes all these costs. Beyond money, it removes barriers like needing childcare or taking a half day off. This increased access is the first step in saving money. The appointment itself is also cheaper. Telemedicine services are generally billed at a lower rate than comparable in-office visits. Lower claim costs are the lifeblood of lower premiums. When an insurer's average payout per patient decreases, they can lower their prices. We see how patients save and insurers pay less per visit, but what is the incentive for the healthcare providers? If providers get paid less per visit, why would they adopt telehealth so widely? The answer lies in one word: overhead. A physical clinic requires expensive real estate, front desk staff, and utilities. Virtual care dramatically reduces these operational costs. Telehealth also streamlines a doctor's workflow. It reduces no-shows and automates administrative tasks, allowing for more patient time. This digital efficiency extends to the insurance company. Virtual consultations lead to faster, cleaner claim submissions and processing. So, providers adopt telehealth because lower overhead and higher efficiency make it profitable. It's a more sustainable business model. Now that we understand the mechanics, let's see what happens when this efficiency is applied at a massive scale. Back to our hook. Emergency rooms. Using telehealth for initial assessments could avoid 850,000 ER transports, saving $537 million. The savings continue in other high-cost areas. In nursing homes, telehealth can prevent unnecessary ER visits, saving another $327 million. Even correctional facilities could cut 4,000 transports, saving over $60 million. These are some of the most expensive healthcare interactions. Each avoided transport means less strain on emergency services and fewer large claims, lowering the total risk that premiums have to cover. But reducing costs isn't just about avoiding expensive emergencies. The biggest savings come from preventing them in the first place. Because telehealth is so accessible, it makes regular checkups much easier. So patients address minor issues before they become major problems. Insurance companies recognize this powerful trend. They are now using telehealth as a tool to actively promote proactive health management. This includes offering rewards for participating in virtual wellness programs or using connected devices that sync with telehealth platforms. The goal is simple. A healthier population generates far fewer high-cost claims over the long term. This is the path to lower premiums. So let's connect all these pieces. How does a virtual visit for a simple rash actually lead to a lower premium? First, your easy access and direct savings make you more likely to use the service. This feeds into a more efficient system for providers. This widespread provider efficiency is what enables massive system-level savings, like avoiding those $500 million in ER transport costs. Finally, this efficient system becomes the tool for promoting preventive care, which shrinks the pool of future high-cost claims. The system is changing. So how do you make sure you are benefiting from it? For individuals, when shopping for insurance, actively search for plans that are telehealth first, or offer discounts for using virtual care. For employers, challenge your insurance broker. Ask them to present plans that use telehealth to lower premiums for the company and employees. Telehealth is no longer just a convenience. It is a core mechanism for managing and reducing healthcare costs at every single level. Review your health plan tonight. Find the telehealth policy. The path to lower premiums might be just one click away.